Hello guys, welcome to Forensic Extract, and today's topic is Thanatology and Postmortem Changes. So we'll discuss today about Thanatology and different postmortem changes which are going to occur after death. So first of all, Thanatology deals with death in all aspects. Thanatos means god of death, that is a Greek term. So first of all, there is somatic death, then later on there is molecular death. Somatic death is complete irreversible stoppage of circulation, respiration or brainstem. According to old concept, this is called as Bishop's triad of life. Then there is molecular death, death of cells and tissue individually. If cells and tissues are going to die, this is molecular death. So clinically, the declaration of death is just on the basis of somatic death. Then there is supravital period or intermediary life, that is survival of some issues after circulatory arrest, that is around 2 to 3 hours. This is the period which is very important in case of you are going to transplant some organs. Then there are different tests so that you can diagnose. These are old tests and these are obsolete now. So first is Magnus test, in which we will apply ligature over the finger, then it swells and become blue if the person is alive, and this is the test for circulation. Now, different postmortem changes after death we can divide into immediate changes, then early changes, then late changes. The immediate changes are insensibility and loss of voluntary power, then cessation of respiration, then cessation of circulation. Then the early changes are pallor or loss of elasticity of skin, then eye changes, then primary flaccidity of muscle, cooling of the body, postmortem lividity, and rigor mortis. Now the late changes are putrefaction, adipocere formation, and mummification. So these are the postmortem changes, immediate, early, and late changes. Now the one term is there that is called as suspended animation or apparent death. This is basically the condition in which signs of life are not found, as the function are interrupted for some time or all reduced to minimum. However, life continues and resuscitation is successful in such cases. The basic metabolic demand of the body is reduced to such level that it is not diagnosed by the equipments like ECG is not able to record cardiac rhythm because the demand is depending on the dissolved oxygen, and body is fulfilling its demand on the dissolved oxygen in the blood. Practitioner of yoga can pass into a trance stage or death like in character. This is very commonly seen, and it is an example of voluntary suspended animation. Then different scenarios there, different cases are there in which involuntary suspended animation is seen, lasting from a few seconds to half an hour, like anesthesia in case of anesthesia, shock, sunstroke, or insanity, maybe in case of electrocution, maybe cholera or cerebral concussion in newborn infant or drowning. So you can remember this example of involuntary suspended animation by this mnemonic: a few seconds. A few means anesthesia, then S is shock, sunstroke, and insanity. E means electrocution and cholera for cerebral concussion. N is for newborn, and D for drowning. Now the guys, different changes in eyes. This is very frequently asked question in both entrance as well as prof exams. The first is loss of corneal reflexes. Then the cornea become opaque in 2 to 4 hours, and cornea become hazy and opaque, so we cannot able to see iris. Then tachynoir appear within 3 to 4 hours. These are triangular areas at the junction of limbus and limbus, that is a junction of cornea and sclera. So these are triangular fold. The base is towards the limbus and apex is towards the canthus. Due to the desiccation or deposition of different particle from environment, if eyes are open after death, then tachynoir will form. Then the Kevorkian sign is fragmentation or segmentation of blood columns in the retinal vessels appear within minutes after death, called as cattle tracking. It appears like cattle tracking or railroad phenomenon. So this sign is called as Kevorkian sign. So these are different changes in eyes. Various changes are there in electrolyte in the vitreous humor, or the overall pressure is decreased in eye due to, and eyeball become flaccid. Now the Algar mortis. This is the exchange of heat between the core. The core is considered as visceral organs in abdomen, chest, and cranial cavity, and the surface of the body occur only by conduction. The curve of cooling is sigmoid or inverted as shape in this pattern. Because initial 2 to 3 hours there is no decrease in temperature because of heat generation. Initially there is heat generation, then later on there is no ATP for that. So there is sigmoid shape curve. Approximate time since death can be determined, and normal body temperature is rectal temperature divided by rate of temperature fall per hour. Then daily variation in the temperature is 1 to 1.5 degree Celsius. So this Algar mortis is due to conduction basically. There are different methods of heat loss, maybe radiation, maybe convection, and maybe conduction. So in case of this is exchange of heat between core and surface is due to conduction. Now the postmortem caloricity, the temperature of the body remains raised for first 2 hours or so after death. Why? Because disturbance of heat production, as in case of sunstroke or some nervous disorders, increase in heat production due to convulsion, as in tetanus or strychnine poisoning, excessive bacterial activity may be there, as in case of septicemia, cholera, and other fevers. So initially there is postmortem caloricity in which the initial temperature is slightly raised, about 2 to 3 degrees Celsius. Now the postmortem hypostasis or livor mortis or cadaveric lividity or suggulations or vabices or postmortem staining. These are different names for postmortem hypostasis. That is a bluish purple or purplish red discoloration which appears under the skin in the most superficial layer of dermis of the dependent parts of the body after death. It is basically due to capillary venous distension. It is caused by the stoppage of circulation and then stagnation of blood in the blood vessels and leads to tendency to sink by the force of gravity. So it is usually seen over dependent parts of the body depending on the posture at the time of death. So it is called the color of hypostasis may vary from area to area in the same body. The intensity of the color change depends upon the amount of reduced hemoglobin in the blood. So intensity is basically depend on the amount of reduced. More the reduced hemoglobin, more the chances of development of that color. Intensity will be color will be more. It is not possible to distinguish the postmortem discoloration from that produced by cyanosis in the living. Therefore, it is not advisable to use cyanosis to describe postmortem appearance. So, in case of it is not advisable to use cyanosis in case of postmortem appearance. It is usually well developed within 4 hours and reaches a maximum between 6 to 12 hours. That is called as primary lividity. That is persist until putrefaction sets in. Now, if the body is moved within few hours after death, the patches of lividity will disappear and a new one will form on dependent part. That is called as secondary lividity. It is intense in asphyxia where the body may not readily coagulate. The blood is not going to coagulate in case of asphyxia, so it is more intense in case of asphyxial death. In case of sudden death with a short agonal period or great circulatory volume. So in these cases, like asphyxia, sudden death, short agonal period, and great circulatory volume, if the is there, then blood is not going to coagulate, then the PM lividity is intense. But it is less marked if death is from hemorrhage, anemia, or wasting diseases due to reduced amount of blood and pigments. Any pressure prevents the capillary from filling, such as collar band, wristband, belts, wrinkles in the clothes, and such areas remain free from color and are such as strips and bands are called babies. This may be caused by the pressure of one area of the body with another, in which cases mirror image blanching may be seen called as contact pallor and contact blanching. So the pressure area will be pale and the other non-pressure area will be full of postmortem lividity. So the pressure area is called as contact pallor or contact blanching. Now the fixation of lividity, the hypostasis become fixed when the blood leaks into the surrounding soft tissue due to hemolysis and breakdown of blood vessels. It is, remember, it is not due to the clotting of blood in the blood vessels. It is basically due to hemolysis and breakdown of blood vessels are going to break down and there is hemolysis. It is not due to clotting of the blood. The postmortem staining gets fixed in 6 to 7 hours and persists till it merges with the discoloration of putrefaction. Now, the physical factor for the fixation of postmortem lividity are blood cannot pass out of the capillary after formation of hypostasis. Then the second one is rigor mortis obliterate the big vessels because after full development of rigor mortis, venules and the capillary are compressed. So it is going to obliterate the big vessels. Then death spots, postmortem ecchymosis. These are tiny spots like spot-like bluish-black hemorrhage limited to area of hypostasis as a result of rupture of subcutaneous capillaries. They are seen commonly in the back of the shoulder or neck and sometimes on the front of the chest or even when the body is lying on its back. So these are tiny spots are called as death spots. Now the hypostasis is more marked in lower limb and external genitalia or lower part of arm and forearm in case of hanging. But if body is constantly moving or PM staining may not develop like in case of drowning. If body is found in running water, then postmortem lividity may not appear because body is continuously moving. The postmortem staining can occur in some cases after death, like in case of cholera. Now the color changes in the poisoning so that we can diagnose by the color change in postmortem lividity depending on the poisoning. Like in case of carbon monoxide, the lividity will be cherry red color. In case of hydrocyanic acid, this is bright red in color. In case of nitrate, potassium chlorate, and nitrobenzene and aniline dyes, it is reddish brown in color. Then in case of phosphorus, it is dark brown or yellow. Then Clostridium perfringens infection, it is bronze color. Then in case of hypothermia, it will be bright pink. Then in case of carbon dioxide poisoning, it will be deep blue. So depending on the color of postmortem lividity, we can get the basic idea about the poisoning. Then the rigor mortis or death stiffening or cadaveric rigidity. This is a state of stiffness of muscle, sometimes with slight shortening of the fibers. What happens that when ATP level reduced to a critical level, that is 85% of normal, the overlapping portion of myosin and actin filament combine as rigid link of actomyosin, which causes hardness or rigidity of muscle rigor. So rigidity of muscle is at its maximum when the ATP level is reduced to 15% and lactic acid level is 0.3%. The maximum postmortem rigidity will be seen if ATP level is reduced to 15% and its start at the critical level is 85% of normal. Now the order of appearance is Nisten's rule, that is, it does not start in all muscle simultaneously. That is, it first appear in involuntary muscles first. The myocardium becomes rigid in an hour. It begins in then eyelids, neck muscles and lower jaw and passes upward to the muscles of face and downward to the muscle of chest, upper limb, abdomen, lower limb and lastly in the finger and toes. So this is the basic uh, uh, the order of appearance according to Niston rule. Now in individual limb it disappears in the same order in which it has appeared. Now the time of onset in India, it begins 1 to 2 hours after death. It is going to begin 1 to 2 hours after death, takes further 1 to 2 hours to develop and get well established in the entire body in 6 hours in summer. In temperate countries, it begins in 3 to 6 hours and takes further 3 to 6 hours to develop. Now duration in India is usually it lasts 24 to 48 hours in winter and 18 to 36 hours in summer. These times are variable because of many intrinsic and extrinsic factors may be there. Now the rule of 12 is that is in case of rigor mortis is it is going to take 12 hours to set in, 12 hours to remain and 12 hours to pass off. This is rule of 12 that is very important in case of rigor mortis. Now the conditions altering the onset and durations. First is rigor does not occur in a fetus of less than 7 months, but is commonly found in stillborn infant at full term. So it is commonly seen in case of if the infant is stillborn at full term. But onset of rigor is early and duration is short in death from disease causes great exhaustion and wasting, like in case of cholera, typhoid, tuberculosis, cancer, etc. And in violent death, as by cut throat, firearm, electrocution, and lightning, it is very early and duration is short. The onset is delayed in death from asphyxia, severe hemorrhage, apoplexy, pneumonia, or nervous disease causing paralysis of muscle. So it is delayed. Now, the death is due to poisoning from hydrocyanic or strychnine. It starts early and persists longer. Frequently absent in person dying from septicemia. The rigor mortis is absent if the person is dying from septicemia. Now the onset is slow and duration is longer in cold water. Onset is rapid due to heat because of increased breakdown of ATP and duration is short. In case of hot weather, hot water, the duration is rapid. Onset is rapid and duration is very short. Now the medical legal importance of rigor mortis is it is a sign of death. It is a early sign of death. Now extent help in estimating time since death, but it is not that much reliable criteria for estimation time since death. Now it can determine the position of body at the time of death because bodies may be there in particular posture at the time of death. Now the conditions simulating rigor mortis are heat stiffening. When the body is exposed to high temperature above 65 degree, a rigidity is produced and the muscles are contracted and desiccated and even carbonized on the surface. So bodies exposed more than 65 degree, then there is heat stiffening will occur. Now the cold stiffening when the body is exposed to a freezing temperature -5 or lower before acid metabolites appear in the muscle, tissue becomes stiff or frozen. So how can we differentiate the cold stiffening from rigor mortis? In case of cold stiffening, there is the body will be ice cold and there are crackling sounds. If we will going to break that or going to flex the limbs, there will be crackling sound will be heard. Then cadaveric spasm or instantaneous rigor or cataleptic rigidity. This is adrenocortical exhaustion which impairs resynthesis of ATP may be a possible cause. No other condition simulate cadaveric spasm. It can be produced by any method of death. So this is cadaveric spasm or instantaneous rigor. Maybe one hypothesis there that this is due to adrenocortical exhaustion. Now the difference between rigor mortis and cadaveric spasm. This is the production is freezing and exposure of temperature. Produced, it can be produced by freezing or exposure of temperature. Cadaveric spasm cannot be produced by above 65-degree temperature will produce rigor. So mechanism is reduced ATP. ATP will be reduced in case of rigor mortis, but the cause of death of cadaveric spasms is not known. One hypothesis there that it may be due to decreased adrenocortical exhaustion. It may be. So guys, what happens in case of rigor mortis? The ATP is reduced to certain critical level, that is less than 15% of normal. But in case of cadaveric spasm, this ATP is reduced instantaneously. The complete exhaustion of ATP is seen in case of cadaveric spasm. And the mechanism is known because it is due to reduction of ATP. The clear-cut mechanism is not known about rigor, this cadaveric spasm. Now the predisposing factors are nil, then sudden death, either at the time of excitement, exhaustion, fear, nervous tension, or violent struggle may be there in case of cadaveric spasm. Now time of onset 1 to 2 hours after death, then cadaveric spasm is going to develop instantaneously because of exhaustion of ATP. Muscle involved are both voluntary as well as involuntary muscles. Both muscles are involved. Single group of muscle are involved in case of cadaveric spasm. Now, the molecular death occurs. Molecular death already occurred in case of rigor mortis, but it is still there. Molecular death is not yet occurred in case of cadaveric spasm. The body will be cold to touch and body will be warm to touch. Then electrically stimuli muscle are not going to respond because already there is molecular death. Then muscle are going to respond. Then muscular reaction will be acidic because the overall environment is acidic due to production of lactic acid. Muscle action is alkaline. Now the medical importance, it is going to determine the time since death. Then it indicates the manner of death. It is going to indicate the manner, the what was the position of the individual at the time of death. Like in case of drowning, the cadaveric spasm is very important in case of explaining the manner of death. Now the medical legal importance is in case of suicide, the weapon is seen firmly grasped in victim's hand, which is strong presumptive evidence of suicide. Or in case of drowning, materials such as grass, weeds, etc. may be found firmly grasped in the hand, which shows antemortem drowning. Or embalming, fluid contain 45% formaldehyde or 10% methyl alcohol. So, guys, embalming fluid, that is basically 40% formaldehyde or 60% methyl alcohol. So we have discussed about primary relaxation, then actual muscle rigor, then the secondary relaxation phase. That is, muscle becomes soft and flaccid due to breakdown of actinomycin due to putrefaction. So this is the technique. This is the method by which we can determine whether the body in primary relaxation of secondary relaxation by the uh, all the findings of putrefaction. If putrefaction is there, then body is in secondary relaxation. If putrefaction is the not occurred, and this is in primary relaxation. Now the putrefaction is the final stage following death, produced mainly by the action of bacterial enzymes. These enzymes are lacthinase produced by Coloration welchi in the most. This enzyme is most important. Now the characteristic features are changes in the color of tissues, like collection of gases in the tissues, liquefaction of the tissues, then first action sign of putrefaction, that is greenish discoloration of skin over cecum or right iliac fossa. Because cecum is more superficial and lots of bacteria is there, these bacteria are going to convert sulf-meth-hemoglobin, causes greenish discoloration. The color appears in 12 to 18 hours in summer and 1 to 2 hours in 1 to 2 days in winter. Now the earliest entrance change is reddish brown discoloration of inner surface of the vessels. This is earliest change. Now the marbled appearance is prominent in 36 to 48 hours. One thing is called as postmortem pulse, that is due to presence of gases in the abdomen and diaphragm is pushed upward, resulting in blood strained from mouth and nostril. Now the postmortem luminescence is called by Armillaria milia, that is a fungi, and Photobacterium fischeri, that is a bacteria. These are going to produce luminescence after death. One thing is called as qualitative putrefaction, characterized by liquefaction of the tissues and begin from 5th day to 10th day after death. Qualitative putrefaction is nothing but the liquefaction of the tissues began after 5th to 10th days. The organ shows putrefaction changes in the following order. The first organ to putrefy is larynx and trachea because more the blood supply, more the bacteria will come over there, and this is going to putrefy first. Larynx and trachea, followed by stomach, intestine, and spleen, then liver and lung, then the brain, then uterus, prostate, and skin, muscle, tendon, and the last is bone. Liver has a honeycomb and foamy appearance. Now the prostate and non-gravid uterus resist putrefaction for a long time. So the gas Casper dictum is decomposition in air, water, and earth. The ratio of decomposition is 1 is to 2 is to 8. Bone began to decompose after death in 3 to 10 years. Then less than 7 amino acid in bone says the age of the bone is more than 100 years. 100 years is other if the number of amino acids is less than 7 amino acid. Now the first amino acid to disappear is proline or hydroxyproline. Last amino acid to disappear is glycine. Now the entomology, megas in a dead body do not appear before 48 hours. Magnin studies the 8 waves of infestation of body by different species of insect. So there are different waves are there. If the body is lying in air, then there are 8 waves. If the body is lying in earth, then there are total 2 waves. So total 10 waves are there. which are going to so that we can determine time since death, or this forensic entomology is very important in decide the stage of that maggot or the larva. Now the adipocyria or saponification seen in the body immersed in the water or damp warm environment. Adipocyria contains palmitic acid, oleic acid, hydrostearic acid or stearic acid. Then changes are due to gradual hydrolysis or hydrogenation of pre-existing fat. So this is due to hydrolysis or hydrogenation of pre-existing fat. Delayed by cold or formed rapidly by warm humid climate. Now the phrase adipocyria is soft, moist or whitish or translucent. It resembles rancid butter. In India, it has been observed within 3 days. Fetus under 7 months do not show this change. So adipocyria is rarely seen in the fetus if its age is less than 7 months. Usually in India, it is seen between less than 7 days. Now the mummification is it is the modification of putrefaction occur when the environment is hot and dry. The body is basically odorless. In case of mummification, the time required for complete mummification of the body varies from 3 months to 1 year or two. Now, arsenic poisoning or antimony poisoning favors mummification. Now, the guys, exhumation is digging out of an already buried body. There is no time limit for exhumation in India. Only done on written order of first class magistrate, that is chief judicial magistrate. Then it should be conducted in natural light in early morning. Then average 6 to 7 sample of earth are taken. Then it is not done for Hindus, performed for Christian, Muslim, and Parsis. So this is the all about thanatology and postmortem changes. That 2 3 different topics are also included. So thank you guys, and please search me if you want me to cover any topic of your interest. Thank you. Thanks a lot.